Hi, Chris Ohl, Wake Forest Baptist Health, Infectious Diseases. Sorry about the week off last week. We'll talk about what's been going on and why I was out last week towards the end of this. But let's start out with our cases. Cases across the country are starting to round off to a plateau. So the rapid rise that we were having during the during August is kind of settling down a little bit. There are a few states that are having trouble still. Right now, number one in the country for cases per 100,000 per day is Tennessee, and followed by Alabama and Mississippi still up there, South Carolina up there, Kentucky up there. So if you feel yourself surrounded here in North Carolina by states that are having troubles, that's actually what's happening. South Carolina's on the higher list too. So there are still climbing and climbing at a fairly higher rate. Where the states that were having more troubles earlier, Louisiana, Arkansas, and Florida, are all starting to decline somewhat. We do have to take into account some case counts out of Louisiana and Mississippi, and maybe New England now, because the weather slows down reporting and power outages slow down reporting, so that we might see some ups and downs because of that in those areas. Um, Here in the triad, our case counts is slowly inching upwards, and still looks like it's inching towards rounding off to be a plateau, which I still expect to occur in the next week or so. We might have a little bit of a shoulder off of that because of Labor Day weekend, people's Labor Day activities. People tend to get together and socialize, and that's when exposures can occur. So we'll talk about Labor Day in a minute. So anyway, that's where we're at. There's been a bit of a shift, particularly compared to last spring, but even in the last month, is that we're seeing a lot more cases in kids. And rather than like last spring, where parents were giving it to their kids in the household, now the kids are getting exposed and then bring it home to the household, and you get either an unvaccinated person getting infected in the household, which can be bad, or you're getting a vaccinated person infected, which is a little bit of annoying, and certainly getting ill is not a good thing, but isn't nearly as dangerous. So while our kids are becoming more of the vectors, so to speak, it's not as concerning for affecting our hospitalization rates as much, because it's very unusual for adults in the family around a kid, unless they're unvaccinated, to get severely ill. Where are the kids picking it up? Well, the kids are back in school, and now most of the districts in our area have gone to masking, and mandatory masking while the kids are in school. And I applaud that. I applaud all the counties who reverse course, going from a mask optional to a mask mandatory. I really do think that's the way to get through the month of September for your school system and keep kids in school. We're really not seeing a lot of exposures in class per se, but after school events sometimes can be a problem. So the Friday night football game, and even more so the pizza party following the Friday night football game, when kids get together and socialize in the high school realm, and or play groups, neighborhood groups, things like that right now. So for parents, I think that having your kid go to school masked and being in a controlled environment is still safe and a great thing for your kids to do. But you need to talk to your kids about other activities after school, um, and around school, and think wisely about what we're advising our kids to do, or what we're having our kids do. We're not seeing a lot of kids in the hospital, and that's good. So it doesn't. We're still looking for really solid data about Delta variant in kids, and really if it's more severe. So far, it doesn't appear to be. Um, I think that while last spring we would have somewhere between 0 and 2 people in Brenner's Children's Hospital with COVID, now we have somewhere between 1 and 3. So it's gone up some, but there's not a lot of kids, and the kids are oftentimes have underlying medical problems. So so that's good news. The the other thing that's come out in the last couple weeks since we last talked is that Pfizer's vaccine is now fully FDA approved for those who are over the age of 16. It's fully FDA approved, and um, and so that could give some people a little bit of peace of mind about getting vaccinated if they haven't already. So I encourage you to talk to your docs and your physicians about that. The under 16, so the 12 to 16 are still okay to get vaccine. Pfizer's vaccine anyway, Moderna will be authorized for this not too long from now. But they can still get Pfizer's vaccine, but it is still under the emergency use authorization. And so it's just a little technical issue. But the FDA has to look now at the kid data in order to give that the full approval. The FDA is also talking about right now in going through the data for kids under 12, all the way down to age 6, maybe even age 3. So when will that all come about? I've been postulating all along, sometime around late October into November. I think it's still probably in that time frame. I think early October, Pfizer is going to submit for the application for the EUA for that age. And then the FDA has to hear it, and the ACIP has to think about it. So it could be a good Halloween present for our kids. Trick or treat, here's your shot. But a lot of us parents are waiting for that, and including me. And one thing that I saw, and I have not heard any specific um, uh, observations of this locally, but in the media, talking about parents going out and getting their kid who's under 12 vaccinated now outside of the UA. And, whether it's you lie about the age or you find some other way to get the vaccine, I would caution parents not to do that. And the primary reason is that the dose we're going to use in kids is going to be lower than the full adult dose because the immunity provided by a lower dose in kids is the same as a full dose in adults. So we don't have to give them quite as much of the antigen. And that means they'll get a little fewer side effects, but they'll get the same immunologic outcome, which is good. So if you're a parent and you have a child under 12, please hold off and don't try to get the vaccine on the sly, let's say. The other thing I want to just briefly mention is ivermectin. So I'm an infectious diseases doctor, and I'm an infectious diseases doctor who has a lot of tropical medicine experience. And I will tell you that I have used quite a bit of ivermectin in my practice and given it to patients. And here's what I have to say about ivermectin. Ivermectin is a great drug if you have loa loa, the eye worm. Ivermectin's a great drug if you have onchocerciasis, also known as river blindness, seen in North Africa. Ivermectin works great for worms like strongyloides, and which I see about 3 times a year here, by the way, or ascaris, which I see about once a year here in North. And ivermectin works really great for Norwegian scabies. So if you got a really, really bad case of scabies, go talk to your doctor about getting ivermectin. But don't use it for COVID. It's a drug that's not even designed to be an antiviral drug. And the way people are using it now off label just totally doesn't make any sense. It is not a substitute for vaccination. And it is not a drug to be using animal doses in yourself, and you will get on the poison list by doing that. So lay off the ivermectin. That's my message on that. I know the group that watches me here is mostly probably not an ivermectin user. That's my advice, both as a physician and as also a public health guy. So lastly, I wanted to talk a little bit about why I wasn't here last week. So Dr. Ohl got COVID, and Dr. Ohl is vaccinated. And I can tell you that in the experience with my family with this is that you can be really careful, and you can um, do everything you're supposed to do. And every now and then, you might get torpedoed by that old COVID torpedo, and you might get exposed. So, at the time of exposure, we kind of knew it happened, and it was one that we would not have been able to avoid at the time. And so I got a COVID cold. Now I'll tell you that nobody likes being sick, and I get a little grouchy when I got sick, and I got grouchy with this too. And that it I've had worse colds, I've had worse flus, but I'm not sure I'd want to go through this one again. So even though it was quote a breakthrough in a COVID cold, it it took me out of commission for a couple 3 days. So no one likes getting sick, and that's me included. But you know what? I was vaccinated, and I'm here talking to you today, and I'm smiling, feeling, on the last day of my quarantine/isolation, and fully recovered. And that would not have been the case had I not been vaccinated. And I can tell you that, and I won't go into all the details, but had I not been vaccinated, I'd be in the hospital right now, quite possibly in the ICU. So get vaccinated. It's the best way to protect yourself from that old COVID torpedo that sometimes you can't avoid. And so I say that, with wanting people to know that from my personal experience, several things. One is that even if you do everything right, sometimes you can get exposed, and it doesn't mean you're a bad parent. It doesn't mean you're a bad person. It doesn't mean you're doing the wrong things. It's a pandemic. It happens. Two is that getting vaccinated really makes a difference. And it made a difference for me personally, made a difference for my family. And I really want people to hear that, and take it to heart. This is not a politician telling you to get vaccinated. This isn't the government. I'm saying just do it. It worked for me, and I know it'll work for you too. Lastly, let's talk a little bit about Labor Day. Great time to be outside. Weather here in the Tri is going to be absolutely gorgeous. Low humidity in the 80s, great picnic weather. You need to wear a mask outside. I still don't think so, no. And nor is it mandated by our city. And when you go in the house, stick a mask on to go to the bathroom. When you come out, take the mask back off again. If you're around public places or at the park, same thing. Always have a mask in your back pocket. So if you need to bring your kid into the bathroom because they gotta go, then you can all put on masks and go into the bathroom. And or if you want to go in and grab a slushie and it's indoors, you can go grab the slushie with your mask on and then come out and take the mask off. Travel, it's probably a little late to talk to people about their travel plans, but it's not exactly where you go, but it's what you do. You'll be masked on the plane. You just need to be masked in public transport. And just be careful about where you're going and what you're doing and what kind of social activities. Large groups of people, particularly large groups of people indoors without masks, are best avoided, and will be for a few weeks here until we get rid of this Delta wave. I still think our Delta wave by mid-September, we'll be looking at the backside rather than the front side of it. Hopefully my crystal ball is still okay on that. but I still believe that to be the case. So with that, I'll wish everyone a happy Labor Day, and we'll see you back next Thursday.